Health check at 11, electroconvulsive therapy, commonly referred to as shock therapy. It is a procedure that many people think is barbaric and only happens in the back rooms of locked mental wards. But that's not true. The question can be asked, is it inhumane or is it helpful? Health reporter and registered nurse Ali Gorman has us with the full story. A closer look.
A closer look. And exactly as you said, Jim, a lot of scary images come to mind when you mention shock therapy. But the truth is it helps millions of people each year. Now, one local woman is sharing her story and the reality of shock therapy. Carol Kivler was happily married, had 3 healthy children, and a great job when she noticed the first symptoms.
I was having headaches. I was having sleep disruptions. More importantly, I was having things like a lack of concentration.
And it got worse.
It was paralyzing.
After a handful of misdiagnoses, her doctor referred her to a psychiatrist who told her she had clinical depression. It affects about 10 to 15% of people at some time in their lives and goes beyond everyday sadness. In Carol's case,
I had a plan. I had a plan to take my own life.
And when medication failed, she was offered electroconvulsive therapy, or ECT, commonly known as shock therapy.
Be over in just a moment. What's that?
Conducting.
That'll do that.
Her first thought was of the barbaric treatment portrayed in One Flew Over the Cuckoo's Nest, where ECT is used as a punishment. But psychiatrist Dr. Johnny O'Riordan says what's in the movies is not reality.
In reality, it's a 10-minute painless procedure, and all my patient is aware of is the breathing oxygen and having a medication that sends them off to sleep.
In fact, in this video taken at Dartmouth Hitchcock Medical Center, it shows the standard procedure. Patients are put to sleep and given a muscle relaxer. 2 electrodes are placed on the scalp. Then
we pass a very small amount of electricity on the scalp, less than what we pass when we use electricity to stimulate the heart.
That sparks a seizure lasting 30 to 60 seconds. That seizure is said to re-energize circuits in the brain that maintain a healthy mood. Typically, patients receive 6 to 12 treatments over 2 to 4 weeks. For Carol, after her first 3 treatments,
and then it was like I woke up.
Still, Carol says she was afraid of what people would think, so she kept her treatment a secret. Years later, she broke her silence, and now has written a book about it. In Will I Ever Be the Same Again, she hopes to help others by breaking the stigma surrounding depression and demystifying the therapy that helped her finally come out of the darkness.
I was productive again. I was Carol Kivler again.
And there is a 60 to 80% response rate with ECT. Again, it should only be offered when other remedies fail. The risks of ECT include problems due to the anesthesia. It can also affect short-term memory in some cases. However, Dr. O'Riordan says there are ways to minimize that effect. ECT is covered under most insurance plans if they cover mental health. We have much more on Carol's story and about her book on 6abc.com.
Thank you, Ali. They held an early